In this short talk, we're going to look at the epidemiological trends in global blindness. The data presented in the talk is taken from two papers in the Lancet Global Health, Trends in Prevalence of Blindness and Causes of Blindness, and also from the Lancet Commission on Global Eye Health, published in early 2021. Another useful source of data is the RAB repository. RAB stands for Rapid Assessment of Avoidable Blindness surveys. More than 300 of these surveys have now been completed in over 70 countries. The data can be accessed at the RAB repository, and the website is given at the bottom of the page. Before going any further, we need to agree the definitions of visual acuity used in measuring the magnitude of global blindness and visual impairment. These are the definitions from the World Health Organization. Normal vision is defined as 6:6 to 6:12 or 20/20 to 20/40. Mild visual impairment less than 6:12 to 6:18. Moderate visual impairment less than 6:18 to 6:60, severe visual impairment less than 6:60 to 3:60, and blindness less than 3:60, that is less than 2400. These measures are in the better eye to define a person who has visual impairment or blindness. All visual impairment in this talk is defined as less than 6:18 to no light perception in the better eye. It therefore includes moderate visual impairment, severe visual impairment, and blindness. If we look at the trends in visual impairment over the last 2 decades, on the vertical we have the number of visually impaired and blind in the world measured in millions. And you can see that in the year 2000, there were 32 million blind people, and that this had increased to 43 million by the year 2020. In 2000, there were 208 million people with visual impairment, and this had increased to 338 million by 2020. If we now consider the causes of blindness in 2020, of the 43 million blind people in the world, 39% is due to cataract and 9% to uncorrected refractive error. It's estimated that 8% is due to the glaucomas, but this may be an underestimate, as in many surveys, visual field loss is not measured. We now consider the causes of moderate and severe visual impairment, that is less than 6:18 to 3:60. And of the 295 million people with moderate or severe visual impairment, 54% is due to uncorrected refractive error. This is mainly myopia, and a further 28% is due to cataract. It's quite useful to consider the causes of visual impairment from a public health approach. And if we do this, then the first groupings are the conditions trachoma, onchocerciasis, and vitamin A deficiency. These 3 diseases can be controlled through improved primary health care, so better nutrition, water, and sanitation. For each of the diseases, there is also an effective medical intervention. For trachoma, it is azithromycin, onchocerciasis, ivermectin, and vitamin A supplementation is used for vitamin A deficiency. Communities that are endemic for these diseases have mass drug administration of these medicines. These 3 conditions do not occur everywhere in the world. They are focal and usually affect the poorest communities and start in childhood. Cataract and refractive error do occur everywhere in the world, in all societies, in all communities. They cause visual loss, but sight can be restored with simple, cost-effective interventions, cataract surgery and the treatment of uncorrected refractive error with spectacles. One-time curative treatments will usually restore sight. Glaucoma and diabetic retinopathy are more complex. In dealing with these conditions, it is important to identify those with early disease so that treatment can be started in order to stop any further visual loss. The aim, therefore, is sight preservation rather than sight restoration. The control measures include screening programs for early diagnosis and then treatment and long-term management. Other conditions such as age-related macular degeneration, uveitis, retinal diseases, pediatric ophthalmology, these require many different specialist services and are usually dealt with on a clinical basis rather than with a public health approach. Of the 338 million people with visual impairment in the world, 262 million, that is 77%, are due to untreated cataract or uncorrected refractive error, mainly myopia, for which we have very effective one-time interventions which are not expensive. If we now consider blindness in children, in this graph, the number of blind children is given on the vertical axis, and then across the horizontal axis are different geographic economic groupings of countries. The total number of blind children is just over 1 million. And the prevalence of blindness varies from 3 to 7 per 10,000 children. In the third column, high-income countries, the prevalence is estimated at 3.1 per 10,000 children. And in the last column, sub-Saharan Africa, the prevalence is estimated at 7.1 per 10,000 children. The main causes of avoidable blindness in children also vary. In low-income settings, corneal scar is common, and this is due to vitamin A deficiency, measles, or conditions like ophthalmia neonatorum, all of which are preventable through primary health care. Cataract occurs in all countries, all regions. The problem in low and middle income countries is often one of late presentation, so that the child does not receive the treatment as early as is possible. In middle and high income settings, retinopathy of prematurity is becoming an increasing problem as more and more premature babies survive due to neonatal intensive care. In 2020, the global population was estimated at 7.8 billion people, and this is projected to increase to 8.4 billion by the year 2030. That is an 8% increase. However, if we look at the population aged over 60, then in 2020, it is estimated to be 1 billion, and this is projected to increase in the next 10 years to 1.35 billion, a 35% increase. Over the next decade, we will therefore see an increase in the global population and an increase in the aged population, those over 60. The result of that increasing aging population is an increase in the magnitude of visual impairment. In this graph, one can see that in 2010, the number of visually impaired was estimated to be 283 million. This has increased to 338 million in 2020 and is projected to rise to 398 million by 2030. So in summary, the key public health trends in global blindness and visual impairment are as follows. First, an increase in the number of blind and visually impaired due to population growth and aging. Second, there's been a reduction in blindness from trachoma and also onchocerciasis and vitamin A deficiency over the last 2 decades. Third, over the same period of time, there has been an improvement in cataract services, both in the quantity of operations being done and in the quality of the results of surgery. Fourthly, there are now increased efforts to address visual loss in children, particularly from myopia, and to address visual loss from glaucoma and diabetic retinopathy. So as we look to the next decade, we can anticipate a continuing increase in the number of visually impaired because of population growth and an aging population. There will also be a change in the pattern of the causes of visual impairment. Trachoma, onchocerciasis, and vitamin A deficiency are gradually being controlled through improved primary health care and mass drug administration. Services for cataract and uncorrected refractive error, particularly myopia, are improving, and this will result in glaucoma and diabetic retinopathy and other eye conditions becoming relatively more important. The management of these conditions, glaucoma, diabetic retinopathy, macular degeneration, pediatric ophthalmology, are more complex, require more specialist services, and require more resources, both in terms of human resources and in terms of technology.